Good afternoon, ladies and gentlemen. Thank you for joining the MPRO's Lake Superior Quality Innovations Network Improvement Kickoff. Your host, Scott Tursky, will begin.
Good afternoon, everybody. Thanks for sharing a little bit of your time with us today. My name is Scott Tursky, and I'm the Communications Director here at MPRO. The purpose of today's meeting is to introduce you to some of the recent changes to CMS's Quality Improvement Organization Program and how it's going to work here in Michigan. To do that, we're going to go through today's agenda. Next slide. The areas that we want to cover today include making a difference here in Michigan, the changes to the Quality Improvement Organization Program, an introduction to the Lake Superior Quality Innovations Network, a program overview, some important contacts, and then if we have time at the end of the meeting, we'll go through some Q&A so we can field some of your questions and help give you a better idea of what's going to be happening with quality improvement here in the state of Michigan. To do that, I'm going to now turn it over to Jackie Rosenblatt, who's the Vice President of Clinical Operations here at MPRO. She's also the State Director for the Lake Superior Quality Innovation Network here in Michigan. Here's Jackie.
Thank you, Scott. So I will be discussing the conceptual changes to the QIO program, followed by May Leonard and Angela Venker, who are the Directors for Quality Initiatives at MPRO, and they will talk a little bit more specifically about the details of the program in Michigan. So overall, the CMS goal for the new Quality Innovation Network QIO program is to really take a look at a more focused, defined regional approach. They decided to develop networks that will support subject matter experts in conjunction with partners to work together to really support healthy people in healthy communities at lower cost. So the program, the QIO program in the past was administered through 53 state-based QIO contracts, and some of those contracts were held by some of those contracts were held by one of the states. So there were 41 contracts. Those of you who are familiar with the QIO program know that in the last scope of work we supported and convened learning action networks, the collaboratives, WebExes that many of you participated in. We provided technical assistance and care improvement through innovation spread, mostly sharing our best practices and really helping to improve the care of Michigan beneficiaries and actually all of the people in Michigan. So some of the things that we were able to achieve in the last scope of work are on this slide. As you can see, we crossed all settings of care. The heart health work was performed in ambulatory care primarily. You can see we had some pretty significant improvement in ABCs. You can see the pressure reduction was pretty pressure also reduction in nursing homes was pretty significant, as was the physical restraint use. And of course, all of our work in reducing readmissions and care transitions, including the 13% reduction in 30-day readmissions. These are things that we were able to achieve in partnership with all of you who are listening in on this call who participated with us. So this is something that demonstrates that working as a team, working together, really can have some pretty significant changes and really some pretty significant improvement. So if we look at some of the changes that have occurred, we intend to continue with the overall improvements in quality, in the quality improvement areas that we've just described. CMS, in order to reach their goal of having a more defined focus and regional approach, changed the structure of the QIO program to call it a QIO QIN program, which is for Quality Improvement Network, and QIO beneficiary protection, beneficiary and family-centered care contracts. In this effort, CMS chose to separate those activities so that no one QIO or organization could do both of those activities in this 11th scope of contract. That's very different than the work that we've done in the past. In the past, as many of you know, we were doing both the beneficiary and family-centered care work, which included reviews and investigating complaints, as well as the quality improvement work. In this scope of work, that is simply not allowed. No one organization can hold both of those contracts. So MPRO made the decision to focus in on the quality improvement network, which is working through much of the work that I just described in the previous slide. So if we look at the other changes that have happened, we can also see that the cycle of the contract has been extended from 3 to 5 years, which allows us significant time to really start to see some improvements in a lot of the quality work that we're doing. And also we have the ability to work together with other states, which we'll talk a little bit more about later. So the BFCC, or the Beneficiary Family Centered Care, is organized into regions, and you can see that Ohio-based QIPRO has 33 states, and the District of Columbia, including Michigan. Maryland-based Levanta is now doing those reviews for 17 states in the U.S., Virgin Islands, and Puerto Rico. And the map on the next slide will give you a better picture of what that looks like. So the areas that you can see that are in dark blue and light blue are supported by Levanta. The middle area of the country, which are in the yellows and oranges, are supported by QIPRO. Those are the places now that take all of the beneficiary complaints. Those are the places for those areas that do any of the beneficiary reviews. So some of the changes to the QIO programs, May Leonard is going to talk about, and I'll let May take that over now.
Okay, thank you. As Jackie mentioned, I'm going to just talk specifically regarding the quality improvement portion of the Quality Innovation Network work. And as she mentioned also, prior to the start of the current contract, the QIO program was really very state-based oriented. And as part of those changes, the current changes, the QIO portion of the contract transitioned from a state-based approach to more of a regional base with networks of 2 or more states per region. Jackie also talked about the structural components of the in the framework of the QIO and the quality improvement work that we currently do, and that will remain relatively unchanged. We will still focus on convening learning and action networks, which are mechanisms for providing collaborative and educational opportunities. We will still be providing technical assistance, and then help to spread the innovation and best practices. So if you look at this map, you can see that the regions are color-coded. There are 14 regions, and if you look, you can see Michigan is color-coded with 2 other states. As Jackie indicated, MPRO made a decision to go after the Quality Innovation Network, Quality Improvement Organization portion of the contract. And on August 1st, 2014, as part of the 11th scope of work, MPRO entered into partnership with Minnesota, which is Stratus Health, and Wisconsin, which is Medistar, to form the Lake Superior Quality Innovation Network. As shown on the slide, while each of the state will be will have a significant impact on their Medicare beneficiaries individually, if you look together, we have the potential for great change. We will be impacting a significant amount of beneficiaries across the region. So focusing on the quality improvement portion of the CMS contract, the program really is designed around certain goals, which include improving patient safety, implementing strategies to increase that patient and family involvement in their own personal and health care choices and as well as decisions, increasing communication across the care continuum in hopes to ultimately improve those transitions of care, focus on effective prevention as well as the treatment of conditions, and then identification and spread of best practices to improve population health. And through the implementation of all these strategies to meet these goals, we hope to achieve the lowering of overall healthcare costs. There are several key roles of the QIO program. While several of these activities will be regional based, such as some of the learning and action networks that I spoke to, MPRO will remain at a local level that will focus on specific statewide priorities. We will continue to focus on in facilitating land, and our contact experts will continue to provide technical assistance in the defined areas, which Angela will be talking about in a few minutes. And lastly, we will remain diligent on identification and the spread of best practices using a wide variety of communication venues. So I'd like to take a minute to have Angela talk a little bit about what those specific quality initiatives are.
Hi, everyone. So I'm going to talk to you a little bit about the quality improvement initiatives that we are working on under our QIO contract, also known as our 11th scope of work. So as is mentioned previously by Jackie and May, we're looking at better health, better care, lower costs. That's how CMS designed our contract. And the different initiatives that we're working on. I'm going to go through this, kind of give you the Reader's Digest version of each, but to give you some detail at least to know what each of these mean. So for improving cardiac health and reducing disparities, we're focused on improving the ABCs of the million hearts, so aspirin, blood pressure, cholesterol, and smoking cessation. And we're also in support in partnership with the Million Hearts program. For the Reducing Disparities in Diabetes Care, we're part of a national initiative called Everyone with Diabetes Counts, which is focused on increasing diabetes self-management education programs to improve diabetes clinical outcomes. For coordinating prevention through HIT and meaningful use, we're assisting providers to achieve the EHR incentive program while also assisting them with increasing communication between patients and providers, most specifically with patient portals. For reducing hospital-associated infections, we are focused on reducing the occurrence of Claudia, CAPC, and C. diff in the hospitals, while also providing education associated with ventilator-associated events. For reducing healthcare-acquired conditions, we're working with nursing homes through collaboratives to increase mobility and decrease antipsychotic use. For coordinating care to reduce readmissions and adverse drug events, we're working within various communities, either currently existing or new creations of communities, to improve care coordination, especially identifying interventions to achieve the goals of reducing readmissions and adverse drug events. And for the last two bullets, for improving quality through the physician value-based modifier and physician feedback reporting program, as well as improving quality through value-based payment. Obviously, you see the theme of value-based purchasing. We are assisting providers with the PQRS value-based modifier and also helping and assisting hospitals with various quality improvement initiatives. One thing I do want to emphasize is that we've been working with many of you on many of the initiatives, as Jackie had mentioned previously, when we showed our improvements, we plan to work with you in the future for these initiatives as well, and continuing those partnerships. So what's different from what we've done in the past to what we're doing now? Of all those initiatives I mentioned, in which you see listed on this visual under the orangey red color, we also included green for the different healthcare settings that you all represent. And so historically, MPRO has always worked with a healthcare setting and focused on that initiative solely based on that setting. However, the way CMS has designed 11 scope of work, and that's how MPRO and the LSQIN are moving forward, is we're taking a more integrated approach to the work. So just to give you an example of what this visual is showing you, if you look pretty much in the middle of the graphic where it shows the care coordination box, you will see that there's many different arrows that are bidirectional to different healthcare settings and to also different tasks within the 11 scope of work. So with care coordination, there's obviously meaningful use involvement. With diabetes and cardiac, there's obviously measures that providers who are participating in coordinating care to reduce readmissions would be focused on cardiac and diabetic measures as well. They're also with reducing HAI and HAC. Same thing, it affects care coordination. It affects those communities. I'm also going to turn to the PQRS value-based purchasing, which is to the right in the graphic. And again, you see very many bidirectional arrows that cross settings with all of the hospitals, with the providers, and with many other different settings. So we're basically trying to show how these tasks all integrate with one another, but also across the settings. So if you are part of one of these healthcare settings, there's more than one program that would benefit you. And this last slide is another visual to just show how the integration happens across the tasks within the 11 scope of work. And just to use cardiac disparities as an example, that if someone were participating, if a provider decided to participate in that initiative, that the diabetes, meaningful use, PQRS, and care coordination would all fall into something that would integrate with cardiac, so it wasn't just focused on one initiative, one project, because as we all know, in different healthcare settings, we're looking across the continuum of care, looking at all different aspects of the patient, and we know that this will create better quality for that patient. So I mentioned all of these initiatives. How do you get involved? On this slide is where our contact information as to how you can get involved with any of our initiatives, and we look forward to hearing from you and reaching out if you haven't heard from us already. And then our last slide, I'm going to actually let Jackie wrap us up. But on this slide is our contact information should you want to contact any of us.
So thank you so much for taking some time to listen to us. One thing, as you can see, we are really very, very cognizant of the fact that there are multiple initiatives going on out there, multiple activities that are all focused on really trying to help improve the care of the people of Michigan and actually across the state, across the country. And we wanted to focus on the fact that we really are trying to align all of those activities. The idea of being able to participate in more than one activity is not so much focused on being able to say, well, okay, now I'm going to work on 4 different initiatives, but really I'm working on one initiative that will have the outcome across all of these positive activities. So that really is our focus, is aligning across all of the activities so that we're not siloing the work that's being done. And we all know that that happens where we focus on cardiac and forget about diabetes in one area. We're trying to help everyone see the linkages there. So with that, I think we can open this up. We have some time for questions, so if there are any questions out there.
Katina, could you follow the process for querying questions?
Yes. Ladies and gentlemen, if you have any questions at this time, please press the number 1 key. Again, if you have any questions at this time, please press the number 1 key. There are no questions in queue at this time. Oh, our first question is going to come from Holland Hospital. Please go ahead.
Will you be sending out a copy of the slides to the participants?
I think we'll be posting our slides on the website. You'll be able to see them on the website, so you'll be able to see them there.
mpro.org.
Thank you.
Again, ladies and gentlemen, if you have any questions, please press the number 1 key. There are no questions in queue at this time.
Okay. Well, great. Thank you again for joining us. If you should think of questions, please feel free to email any one of us or to the communications department. They will be happy to forward your questions on.
Thank you, everyone.
Thank you.
Thank you, ladies and gentlemen, for joining. This completes your webinar. You may all disconnect, and I hope you have a wonderful afternoon.